Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my compilation of big earwax and small ears. So this is patient 1, client 1, and we're in the patient's right ear, and you can see this wax, it's quite lateral near the entrance. We know that because of the cilia. Just using a standard Zollner suction probe, you can see this Zollner suction probe is almost filling up the whole ear canal. Now, the diameter of the Zollner suction probe is 2 millimeters, and I think you'll be very hard pressed by to insert 2 of those in the ear canal. So, which means approximately the patient's ear canal diameter is around 4 to 5 millimeters, which is quite narrow. This is both in terms of width and height. The patient's got a very circular ear canal. Typically, most people's ear canals, the height is greater than the width. So I removed the big plug that was lateral. This is some more crusted, darker wax. So you can see it's oxidized. It's a bit drier, a lot of keratin in there. It's been in there for a lot longer. Now, the patient's ear canal, you can see here, it's completely shut, closed. So I'm having to stretch the ear open. We use the endoscope then to keep the ear canal ajar, almost like a doorstop, which then allows ample space for me to insert the full Zollner suction probe. So we've got maximum power there. So this wax is a lot more medial. You can see how I've just stretched this ear open. We can do that because the cartilaginous portion of the ear canal, the outer third, is flexible, or semi-flexible, shall I say. I'm just trying to bring this wax slowly outwards. And once we're at the ear canal, as I said, the ear canal is virtually shut and narrow, so we have to meander it out. So a bit of wax impacted directly on the patient's eardrum. I'm going to use a fine end gauge now. So a fine end gauge in this patient's ear looks like a standard Zollner suction probe in a normal person's ear canal. So we just got that directly off the eardrum. The patient's got quite a bendy ear canal as well there. There is some residual wax on the superior anterior canal wall. You'll see that in a moment. We'll remove that. See there, just kind of northeast, we can call it. So just have to bend the fine end gauge here just to bend around this prominent anterior wall. You can see the bend there on the fine end. And that's what we need to do. We can see the whole eardrum now. In fact, we didn't even need to do that. The patient was hearing okay, but I felt confident. The patient was very still. So just mopping up near the entrance. And you'll see some close-up images of the wax and skin plugs that we removed in a moment. You can see quite a few cilia there. See, there's some dark pieces of wax and skin, so it's oxidized. Now we're on to client 2. Now this patient had an extremely narrow ear canal. So just using a Zollner standard, a full suction probe here, full standard Zollner suction probe, and it's very difficult to insert this into the ear canal. You can see it's just collapsed, so there's a bit of inflammation at the entrance here. Nonetheless, I did manage to stretch the ear open in a moment. You'll see this. I think I've just reverted to the fine end at the moment, but the fine end is just not powerful enough. I think at this stage I've reverted back to the full Zollner suction probe, and I've managed to stretch this patient's ear open. This is the patient's left. It's a different patient to the first, completely different client. However, this wax is really lodged. Now, where this ear canal is narrow, it then widens again. So you've got a large plug of wax that we're trying to bring through a narrow part of the ear canal. And this wax is really hard and it's lodged. Therefore, in a moment, I'm going to revert to a St. Bart's ear hook. You can see I'm really giving it a tug there, but it's just not coming forwards. So I think this is the moment where I use an ear hook. Oh, no, it's going back for one more attempt with suction first. see there, it's just not coming forwards because the ear canal narrows. No matter how hard I try to suction this out. So I'm just inserting an ear hook, and I'm on the posterior canal wall. I'm just trying to embed the hook into the plug of wax and bring it forwards. So we got a small piece out there. We're almost chiseling into little pieces. Again, on the posterior canal wall, just trying to lever the wax off the canal wall with all the skin adhesions. So I'm gliding it in and then rotating the hook clockwise by about 20-30 degrees. Slowly but surely we bring this out. You can see a huge plug of wax and dead skin. And when I go back in, you'll have an appreciation of just how the ear canal widens. So this is the narrowing, and then the ear canal widens, and there's the patient's eardrum. Hope you enjoyed that compilation, guys.